Hello, my name is Robert Ricca. I'm a physician at Greenville Memorial Hospital. I'm one of the pediatric surgeons who is lucky to be able to care for the children in the upstate of South Carolina. What are some common indications or reason that my child may need a gastrostomy tube? There are many reasons a child may need a gastrostomy tube. Mostly, the child would need a gastrostomy tube because they're unable to take adequate nutrition by mouth. The reasons for that can be varied, and we see this in many children who are ranging in age from a newborn up to a child that's 18 or even older. This may be due to a medical condition that is present at birth or a condition that is acquired over time. We see this in children who have sustained trauma or who may be sick from other reasons. Due to this, the G-tube may stay in for a short period of time as the child heals up from whatever inciting etiology is present, or may be required for a number of years. Either way, our team is here and happy to help and there to support you as your child continues the recovery process. How long does your child stay in the hospital after a gastrostomy tube? Gastrostomy tubes are placed in the operating room. Typically, a child will stay in the hospital from anywhere from 1 to 3 days, depending on what the underlying reason for the gastrostomy tube is. In many cases where the child is an outpatient and just requires it to help out with the nutritional support, the child may just need an overnight stay. If your child is already in the hospital or is being seen for other reasons, then the medical issues may require that the child stays in for a couple more days after that and will be dependent upon what the medical team decides. Typically, we try to start our feeds in the gastrostomy tube within the first 24 hours and then advance the feeds over the next day or so until the child is ready to go home. When will our family receive training regarding our child's gastrostomy tube? That is a great question, and I think one that many families wonder about to make sure that they're adequately prepared to take care of a child with a gastrostomy tube as they come home. Our goal, especially when we're able to see the child in the preoperative clinic before the gastrostomy tube, is to begin the teaching the first day we meet you. We can show you what a gastrostomy tube looks like. We can go through some simple care. We even have some mock-up to show how a gastrostomy tube would be placed in your child. That training then continues to the inpatient stay. After your child receives a gastrostomy tube, our nurses in the hospital are all trained in how to teach a patient and their family how to care for the gastrostomy tube. We have our outpatient services come and show you how to use the pump that will help provide the feeds to the child, as well as how to connect and disconnect tubing to the gastrostomy tube. Once you feel comfortable with that training, then you're discharged to home. But our relationship continues, and our nurses in the clinic will continue to work with you to make sure that you're comfortable with the care. That care will be a local cleaning around there with just some gentle soap and water to keep the area clean and to make sure everything is healthy. And we will go over routinely how to change the gastrostomy tube, when to change the gastrostomy tube, and other items that may come up. Just to remind you, we are present the entire time to help out with any of the questions that you may have. How do I care for a gastrostomy tube? I think this is a common question that many families ask, especially when I'm seeing them in the postoperative recovery room as well as in the postoperative clinic. Caring for the gastrostomy tube is pretty simple. We just need to keep the area clean and dry. That can be done with a little Q-tip, soap and water, and just to clean underneath the gastrostomy tube as it's present. And then sometimes there are some issues that may show up. One of the common things that we see is granulation tissue, which is the body's attempt to heal the tract that is formed from the gastrostomy tube. This will show up as some pink tissue that may bleed at times. We can treat that just with continued cleaning of the area, as well as some medication that we can apply in the office for you. That may involve something called silver nitrate, which is a medication that can curb the growth of the granulation tissue, as well as some topical steroid creams that we can prescribe to have you apply at home. Either way, those issues with the granulation tissue will improve over time as the gastrostomy tube site heals. We then tend to change the gastrostomy tube every couple months. Typically, we try to wait 3 to 4 months, and then we place a new gastrostomy tube in. The first couple changes we are happy to do with you, but we'll be able to teach you how to do this so you can even do this at home. and allow you to feel more comfortable with the gastrostomy tube itself. When should I go to the emergency room, or when should I call the clinic regarding the gastrostomy tube? We are always happy to answer any questions from the clinic about your child's gastrostomy tube. One of the most pressing concerns that would require you to go to the emergency room is if the gastrostomy tube becomes dislodged or it comes out, basically. This can happen for many reasons: if it becomes tangled, or if the child pulls on it, or if the balloon that holds the gastrostomy tube in breaks. And by learning how to change the gastrostomy tube, this will make you feel more comfortable in replacing the gastrostomy tube. However, if the gastrostomy tube is new within the first couple weeks to months of having it been placed, or if you're concerned or unable to replace the gastrostomy tube, then that's something to bring your child in to the emergency room, or if it's daytime, to call our clinic to make sure that we're available to have the gastrostomy tube replaced. Time is of the essence with replacing the gastrostomy tube, because the tract that we have there will decrease in size over time, preventing us from placing the gastrostomy tube back in. Especially if you have some difficulty replacing the gastrostomy tube, that is something that we need to know about. Otherwise, routine questions about the care, granulation tissue, some mild pain or redness around the site can just be managed by the clinic and doesn't require a trip to the emergency room for a discussion. Again, we're available 24/7 by phone to answer any questions you might have regarding your child's gastrostomy tube.